3, 2, 1. And you're probably live.
You need your phone.
Yeah, I know. You're live.
I'm live. Oh, excellent.
Yeah.
Welcome back to Fertility Factor Fiction. I am your host, Dr. Rahi Victory, double board certified reproductive endocrinology and infertility specialist, licensed in Canada, the US, and now the UK. So very excited about that. And coming to a UK clinic near you soon. If the camera doesn't move all over the place. So I am here with my dear friend Tarek Ibrahim from Ibrahim Strategies Group, and we have been away for a while. I was on holidays. Huge shout out to my friend and incredibly talented opera singer tenor Jonathan Tettleman, and his lovely wife and family. We were with them in Neuschwanstein, Germany, where he performed in the courtyard of the castle. And I forgot to mention to you that we got absolutely thrashed by rain, but it was an amazing time. And he and I went bombing around the Autobahn and around the lake in a very nice sports car. So had a great time. Huge thanks to my wife who made it an amazing trip. And then my whole family, because we went up to our cottage and hung out. So we are back this week. We are going to go directly into answering your questions because we missed a couple of weeks there. And I will not be away again for a while, so don't worry, we are here for you. So if you have questions about your fertility, you want to know anything that we can answer, as long as it's not a direct help me kind of thing, we're more than happy to offer whatever information that we can. I cannot give you direct medical advice unless you're a patient, but we can give you information about topics, education, and ways to help improve your fertility journey. I'm going to share a post on an upcoming Instagram reel that you guys should look for about a patient's experience at another clinic. The clinic shall remain nameless because we always protect the clinic, but I was absolutely so horrified at the way this patient was treated at another clinic that I apologized on behalf of all reproductive endocrinologists because it was that bad. So make sure that you're getting good care no matter where you go. And I think one of the other reels we're going to come up with is, should fertility patients be considered clients or should they be considered patients? It's a huge question. It's an age-old question, and it's a big one. Like, are you a client or are you a patient? Because you're paying for your services, and so in some ways you are a client, but at the same time you're getting medical care, which still makes you a patient. Or are you something new? A client or something like that. I don't know.
Nothing new. No, nothing new.
Nothing new.
Patient
Or client?
Only patient.
What if there's
It's like maybe it needs like its own entity. I like that. Actually, I've coined a new term, client. You're a patient that's a client. Because you are, right? Like a lot of these patients, especially in the US, they're paying for their services. And in Canada too.
That's true. Paying
a lot. Yeah. Also, huge shout out to Minister Sylvia Jones and Doug Ford, the Premier, who met with Wendy yesterday.
Oh, cool.
Yeah, so more exciting stuff happening at VRC, hopefully. So we'll see if that pans out. I didn't get a chance to tell you about that. But yeah, very excited. Wendy met with them yesterday. Great guy. I am apolitical. I don't care what political party you believe in. I don't really believe in political parties at all, but he's just a good person, and so is Minister Jones. They're genuinely trying to make things better. They help the people in this community by getting us IVF funding. We're hoping that they'll help us with some other projects we're working on. So yeah, we'll see. Very exciting stuff. So on to your questions. Anything you guys want to ask, I am here for your question and answer period. As is Tarek, who frequently will try to answer some questions.
I was going to say that if you can't answer the medical advice,
they got you.
I can. I'll do it. Now, if anything bad happens, let's just remember I don't really know what I'm talking about. But other than that,
I do have a question for any women that are watching the show today. How fast would you let your husband drive before you told him to slow down?
Great question. Great question.
I want to know that one. The Autobahn, I did manage to hit 200, which was very fun and very cool. but my wife wasn't having it.
200 kilometers, 200 miles.
No, 200 kilometers.
200
kilometers.
Oh, 200 miles, you're
fine.
You're fine,
You're
yeah.
fine.
Fastest I've ever gone was 165 miles per hour,
Mm-hmm.
which was 260 kilometers an hour.
So, you know,
if I may, so 200 kilometers, I hear on the Autobahn people go 300.
Yeah.
But you kept it cool at 200. Did you feel the car wasn't able to go faster, or?
No, it was wet.
Oh, it was wet. It was wet.
And
Yeah,
Wendy,
for sure.
And Wendy wasn't having it.
Yeah, no, wet.
She's like,
that is not
no,
ideal condition.
slow down. So yeah,
Uh,
I've been at 265, and granted at 265, no one was telling me to move, but I've been on the Autobahn doing 220, and a car came up behind me flashing its lights for me to get out of the way. And so I moved over to the right because I was in the left lane. And then he pulled in front of me, also in the middle lane, and motorcycles went past him.
Oh, wow.
And he was doing easy 240, so they must have been doing 280
Oh, wow.
on motorcycles.
What
What a rush.
What a rush.
All right, what non-car related fertility?
Yeah, I guess that's what people came here for.
But I do want to know from the ladies in the group, how fast would you, or guys, how fast did you let your partner go before you told them to slow
Carly says 130.
down?
Carly's not even driving. Carly's in the scooter.
Carly, that's nothing. That's like, you can do 130 on the Windsor to Chatham span of the 401 now, and they won't even pull you over.
Yeah, so some people on TikTok are mentioning that the audio is a little bit echoey today. We know.
We don't have our mic on TikTok. Sorry, guys. Yeah, my apologies for that one. That's my bad.
That's our bad. That's my bad more than anyone's bad. But
Here
here we go.
So
we'll take a question from TikTok.
Yeah.
Oh, Carly's just too scared. She doesn't want to die. That's her reason.
But
Oh, 130 is pretty slow.
You won't die if you're with a good driver, Carly.
I'm going to be a great driver tomorrow. I keep on miscarrying at week 5. They are referring me to immunology.
Where's the question?
I guess it's just like, what's the deal?
Yeah, I mean, week 5 miscarriages could be genetic, could be immunological, could be microbiome. Shape of your uterus would be important. Vitamins, sperm DNA fragmentation. All of those are possibilities. So I'd be looking at all of those things.
Question from Instagram. I'm 7 weeks pregnant and having dark brown spotting. It's very light, but I've had a miscarriage before, so can't help but worry. Is this common, and what causes it?
So about 20 to 25% of women will bleed in their pregnancy. What causes it? It's most often a subchorionic hemorrhage, although there can be other sources. Your cervix, intercourse, infection can do it. Miscarriage can cause bleeding as well. Ectopic pregnancy can be associated with bleeding. So there are a variety of sources. It's very important that you get checked out. Make sure they know where the pregnancy is, that the pregnancy is viable, and it's in the right location. What can you do to stop it? So typically in our practice, we'll have a discussion with you about what you're on. If you're on blood thinners, we tend to stop them, but you have to talk to your doctor. And we reviewed the use of alpha lipoic acid, ALA, on the show, excuse me, probably about 6 months ago, and demonstrated that it is very, very significantly beneficial in reducing bleeding, cramping, duration of bleeding, size of hematomas, and possibly even miscarriage. So we put all of the patients that have bleeding on ALA. So those are the things you can do to try and help you. Aside from that, there's no proof that rest works, but I don't tell my patients to run out and do weightlifting or go have wild sex if they're bleeding. Obviously, you tell them to observe pelvic rest just in case.
My husband does 280 kilometers on the Autobahn.
Yeah, wicked. 280.
I like that one.
You're
Booking it at 280. So I'll tell you something. I was in a Porsche, a nice Porsche.
Oh, someone has a Porsche. Hold on, before you go. Someone did on a Spider RS.
Oh, yeah.
Has a top track speed. They did 191 miles.
Oh, wow. I am very familiar with the Spider RS. So I will tell you that at one at 165 miles per hour, the car started feeling light. So up until then, the steering's pretty firm and you're feeling it, and you don't worry about a little shimmy. At 165, there's so much air rushing under the car, it's turning into a wing, and it's even with the spoiler up, it was getting a little antsy.
Really?
Yeah.
Oh wow. Oh wow.
It makes you appreciate all this stuff for downforce.
For sure.
Yeah.
Oh, big spoilers.
The big spoilers. Yeah.
From YouTube, hi docs, why Lupron without letrozole is useless, and what does letrozole do for FET? Thanks.
So Lupron without letrozole has been proven to be useless or detrimental. There is no evidence that taking Lupron before an FET is beneficial, even if you have endo or adeno. Lupron plus letrozole, there are 3 studies that have looked at that, all of which show a benefit. But Lupron alone, I'm not aware of any studies that show an advantage. Orlissa, never studied, so that's one I see commonly that has no evidence, so I don't recommend that either. A lot of people keep asking me about using norethindrone acetate, which is a type of progesterone. 0 evidence on that one as well. Or using Lupron with norethindrone acetate, which again has 0 evidence prior to FET. So we don't encourage anybody to do that. That doesn't make a lot of sense. With regards to doing it with the letrozole in your
FET cycle, if you're combining the two, that's great. If you're just using letrozole has been proven to have the highest success rate. Our recent post I put out on showing the guy in the bomb suit going to tell his colleagues about not using hormone replacement therapy protocols. Someone very well known in the fertility community, I won't say who, challenged me saying that what I had said was not evidence-based. And I was like, what? So I said, well, I'm kind of surprised you're saying that, since it was presented at a conference with over 300 people present or 250 people present in Europe. And the evidence overwhelmingly supports what I said. And you can even ask AI. And they offered to debate me. And I said, yeah, like, come on, Fertility Fact or Fiction, I'll do the debate. Just, crickets.
Yeah. I bet it was.
Chirp.
I bet it was.
There's nothing out there. I haven't heard back from that individual. So I'm hoping they figured out that they were wrong, but nothing. Crickets.
Hello from Kitzbühel.
Oh, I know who that's from.
When to start Tacro and intralipids, and when NK cells are through the roof?
That's Yana.
Very good memory.
I know, because she's always at Kitzbühel. Hi, honey. When to start Tacro? It depends on how high your cytokines are. We'll start as early as a month, or as late as a week before the frozen embryo transfer. So anywhere from 1 week to a month, depending on how bad your immune system is and how dysfunctional it is. And I hope you're enjoying Kitzbühel. She always sends me these pictures, and she's in like the German outfit.
Oh, I see.
Oktoberfest.
Oh, Oktoberfest. Yeah. November 2023.
Okay.
AMH 19.
Yeah.
July 2025. AMH 12. Is this a red flag or normal? Was told it's not a concern. 35 years old.
I'm going to answer that and give you a clip you can use.
There we go. Thanks. I'll take it. I'm ready.
I'm going to shock you all and tell you that I am firmly convinced that women who have a rapidly declining AMH actually all suffer from one very common condition. We know that there are women that have a normal AMH, like you mentioned, 19, and then just 6 months or a year or 2 years later, it's already down by half or close to that, and continues to decline quite rapidly. Now, there is no evidence that there's a single thing that causes this, unless you have something like thyroid disease or an autoimmune condition. But I am convinced 100% that all of the women that we see that suffer from this rapidly declining AMH, and I think it should be a hallmark criteria for the diagnosis, is endometriosis. Women who have endo often have a rapidly declining AMH level. And because of that, I think that there is, use or utility in noting that as a marker for the fact that those patients likely have endo present. So if you have a rapidly declining AMH, I would be very concerned, because not only is your ovarian reserve diminishing, but you're also likely facing the presence of endometriosis, which means you're going to need to take extra good care of your timeline and of your protocols to ensure that you get the best outcome possible.
And we're jumping to Instagram here. Hi.
Hello.
Should aspirin be used in a twin pregnancy? If so, how much?
Yeah, I mean, any high-risk pregnancy, the high-risk specialists are saying use 2 baby aspirin, so 160 or 162 milligrams per day. So we're moving towards that for our twins, and we'll be starting that now for the twins. We generally have most of our IVF patients on at least 1 aspirin. There are some exceptions, but generally speaking, everybody's on at least 1. High-risk patients, so obesity, age, previous history of high blood pressure or preeclampsia, predisposition based on something like lupus, all those patients would require twins being on more than 1 baby aspirin. They should be on 2.
My husband has hypothyroidism.
Okay. Rare, but it happens.
Do you think IVF is still considered if untreated? Doctor says he doesn't need meds.
Hypothyroidism or hypogonadism?
Hypothyroidism.
Well, if he has true hypothyroidism, he should be on meds usually. So I'm not sure why they're saying no, but I would need to know more details. Can you produce good sperm with a dysfunctional thyroid? Yes, you actually can. Would I recommend it? No, because you want to optimize everything before you do your IVF. And spending a month to optimize your thyroid is going to have 0 negative impact on your fertility outcomes, but a huge positive one. Yeah, so that doesn't make sense to me.
Dr. Victory, there's a small polyp near the front of my uterus, opposite end from where an embryo would be placed. Is it worth doing a hysteroscopy to remove before an FET?
Yeah, so the problem with polyps is that they disrupt endometrial function in the area around where the polyp is. And we don't know how far those signals can go, like the chemical signals that are, inducing these abnormal and non-supportive changes in the endometrium. So the recommendation generally is, if you have a polyp, remove it, because it is associated with a decreased chance of success and an increased risk of miscarriage. So we always advise removal.
After IUI, BBT dropped by 0.3 degrees on DPO8.
Okay.
And another slight drop, DPO9. Still on progesterone, but wondering if this is a sign it is a failed IUI, and if prog is just delaying an inevitable period.
Basal body temperature monitoring has been proven to be useless. Stop doing it. It's annoying. It's highly altered by other things that are going on, including stress, anxiety, temperature of the room, the temperature of the season, your air conditions, all sorts of different things, the clothing you're wearing. No one should be doing basal body temperature monitoring, in my opinion. It's completely useless. So is cervical mucus monitoring, although some people would disagree with me on that one. But I've presented studies on that before showing it's a very limited value.
What is the ideal sperm count and motility for IUI after sperm wash and Zymo?
So Zymo is hard to say, because there aren't any studies I'm aware of that say this total motile count post Zymo is optimal, although I haven't really looked at that. I'd be happy to look it up for you. But without Zymo, between 9 to 14 million has been shown to be the best number minimum total motile count. So 9 to 14 million rapidly swimming healthy sperm is the best number. There's 2 studies, one said 9 million, one said 14. So those are the baseline minimums. With Zymo, you definitely typically get way less sperm coming out, but it's much better quality sperm. So we don't know yet. That might be a good study to do for us. We should have enough data for that.
I got a question here for you.
You got a doozy?
I got something.
Do I need like pen and paper, or will
No.
I remember?
No. I would let you know. I would do that favor. Hey, found out from positive OV test to period is 68 days. I'm 45 and have been TTC for months. No IVF doctor told me I needed progesterone. I found this out myself. Would this be a reason it's not happening?
Well, a 6 to 9 day luteal phase is way too short. So think about it. I mean, 5 days into it, you're implanting. So there's no way the embryo is going to survive an implantation if you're going to start bleeding 6 days after. So either your timing is off, like you're not ovulating when you think you are, which is actually more likely, or you do have an extremely short luteal phase, in which case, yeah, I mean, we would immediately switch to progesterone. Now, luteal phase defect was actually disproven back in 2001 by a randomized controlled trial where they actually assessed the endometrium and looked for the luteal phase and assessed it for a defect and found it had no bearing. And it was in a Clomid or letrozole study run by the Reproductive Medicine Network. However, there's no question that if your luteal phase is that short, I can't imagine any doctor wouldn't tell you to take progesterone. It just wouldn't make sense.
I had pneumonia in February. Picked up some sort of bug a little over 4 weeks ago. Laryngitis and a cough. Laryngitis resolved, but the cough persists. Is it okay to do an FET, or should the cough resolve first?
No, I mean, anytime you've got a cough, laryngitis, post-viral symptoms, wait for all that inflammation to settle down. We know that inflammation is highly predictive of your success. We presented a study on this show probably a year and a half ago, that looked at the simplest test possible, which was just measuring components of your complete blood count, the CBC. And it was just a simple equation looking at platelets multiplied by white blood cells divided by lymphocytes or something like that. I don't remember the exact equation now, but it was a direct link to how much inflammation is in your body. And it was absolutely correlated with your outcome. So if you have inflammation present, do not do an embryo transfer. It just cuts down your chances. Even if you still get pregnant, great, hallelujah, it worked for you. But a lot of people are not going to get pregnant and they're wasting embryos. And you're wasting time and you're wasting money. So don't do that. If you're inflamed, wait until the inflammation settles. Or find a way to quell it if it's autoimmune inflammation or endo or something like that.
Interesting question.
Okay.
Not so interesting, but interesting nonetheless. Hey, doctors. So this implies us, of course, right? So that's why the part 2 of this question is so interesting. Is why do you, meaning again us, right? Why do you offer Endomer when you, I guess this is us again, aren't convinced by the science behind it?
So we don't offer Endomere because Endomere was shut down. We briefly offered Endomere because I wanted to see how useful it was. And we are involved with them in doing the trials that Health Canada is demanding they run in order to validate their product so that they can actually market it. I think that there is tremendous value in having a test that can detect endometriosis without needing to operate on people, because it takes forever to operate on people in Ontario. And in the US, it's expensive to operate on people. So both places, you're basically damned if you need surgery. And then you have all the risks of the surgery. Hell, if we can do it from a simple blood test and it's a yes, no, you've got endo, no, you don't have endo, it makes a huge difference in how we manage people. You know, day after day, I'm posting on the fact that patients with endometriosis don't do as well. And anyone that tells you otherwise is absolutely either unaware of the truth or lying to you. So there is no question that endo has a huge impact. The problem is we don't have a good test yet. And many people are claiming they have a test, but they don't. So I'm happy to explore anyone's test. And we try with an American firm that was trialing a product as well. But in the interim, I believe in the science behind the tests. I just haven't seen a test yet that's 100% yes, no. It doesn't have to be 100%. Even if it was like high 90s, I'd go for it. High 80s even, I'd probably go for it. But there's no test that is that convincing yet. So when we find one, I'll be all over that sucker.
And I just do whatever you do, to be honest. So, if you like it, I like it. You know what I mean? It's kind of how it goes here. Dr. Victory, do you recommend taking DHEAs if low in blood work?
Yes. And for years now, I have followed the research, which never really looked at DHEA levels. But apparently there's research evolving now that supports that if your DHEA levels are high, that there's either no value or possibly a detriment to taking additional DHEA. I have not seen the studies yet, but apparently that's a thing. So I'm going to start looking at those studies over the next few weeks to dive into them and see, how involved is this and should we be measuring this in everybody? But certainly if your levels are low, you will benefit, and there's lots of data for that.
So going back to the speed of the car.
Yeah.
Somebody wrote that they would wet their pants in a sports car going that fast.
I've never wet my pants in a sports car, but for those of you that don't know, I'm a car fanatic. Tarek also loves cars. So I did rent a very fun car when I was in Germany and did go blasting down the Autobahn. But my wife started yelling at me when I got to 200. Actually, she started yelling at me before I got to 200.
Yeah, I bet. And then another one saying that every 50 kilometers an hour is an extra 1,000 towards a designer bag.
Is that my wife?
It's not your wife, but I thought, who is this individual?
Yeah, I that's a good approach, That's a really good approach.
Can we reduce the impact of DNA fragmentation by doing IUI?
Yes. Zymet and other microfluidic chambers like the one we used from Lens Hook all reduce DNA fragmentation very significantly. If you want to save yourself some money, ejaculate once and then 3 hours later do it again. It's an 80% reduction in DNA fragmentation. Big part of this show, big part of the reason we love this show is we try and save people money all the time. We tell people not to do things that are useless. That was actually the impetus for starting this show. It was double IUI. Double IUI is useless. It's been proven useless. It was our first ever episode. So if I can save you money, I happily will, because I don't do this just to make money. I do this to help people. And so you don't need to spend a lot of money on doing Zymet or Lens Hook or whatever. Ejaculate once and ejaculate again 3 hours later, 80% reduction. Don't smoke, don't drink, don't use drugs, take loads of vitamins, ejaculate frequently. All of those help reduce your DNA frag and will improve it. And keep your testicles cold. That's important too.
Can an egg donor be selected, or does it have to come from an agency? My sister-in-law is looking to try one more time after 2 failed IVFs, but would like to know her egg donor. Can it be done without hormones? The potential egg donor is looking to conceive herself, and she is in her mid-30s.
Oh boy. Okay, lots of questions there. So, can you know your egg donor? Absolutely. In Canada, you're allowed to have known or anonymous egg donation, and it's up to you. You can select whichever one you want. So if you want to know your egg donor, great. We can put you in touch with agencies that will help you find a known egg donor, or what we call a directed egg donation. If you know your own egg donor, it's your sister, it's your cousin, it's your best friend, it's your niece, whatever. We can do that too. So that's also possible as long as you pass psychological screening and there's no coercion and things like that. Can you know the details about the egg donor? Extensively. I mean, we don't do it unless you know it. In fact, we present you with a whole document that has infectious disease, toxicology, genetics, infectious disease questionnaire, their psychological analysis. Like, it's all there for you to look at, and you've got to sign off on that before we actually say, yes, you can go ahead. Mid 30s as an egg donor. So keep in mind, by the time you're mid 30s, 50% of the eggs you produce are genetically abnormal. So do we use 35-year-old egg donors? Yes. How often do we do it? Almost exclusively when it's a family member. So if you show up and you're 35 and for whatever reason you've had diminished ovarian reserve, ovarian failure, failed IVF cycles, whatever the case is, and you want to use your sister and she's also 35, or let's say you're 37 and she's 35, would we let you use her? Absolutely. On the other hand, if you show up with an egg donor that's 35 and you're doing it from an agency, I would almost universally tell you no, because you're paying for something that is not optimized for you. Now, if you find a 32-year-old and less, like kind of 21 to 32, that's the sweet spot. That's the best age in which to get an egg donor. Ideally in that like kind of 24 to 28, 29 range. Those people do very, very well as egg donors. Once you're getting below that, terrible. Once you're getting above that, also not great. Certainly at 35, you're facing the fact that half of what you're paying for or getting from whoever's helping you with it is not going to be usable. Can you do it without hormones? Yes, you could do natural cycle IVF off of a donor, but if it doesn't work, you got to bring them back next month. If that doesn't work, you got to bring them back the next month. It's expensive, although our natural cycle IVF is very inexpensive. It's actually under $7,000, but you'd be doing it multiple times and it would add up eventually if it didn't work after one or two tries. So I can't say in an egg donor situation that I would endorse that as being a rational approach, but would we offer it to you? I mean, if that's what you want, that's what you get. We're all about working with you. Which brings me back to that post from a very famous fertility center that we'll be posting about, where they literally told the patient, we will never discuss any of this with you again. And that she was wasting their time. It just blew my mind.
I love that.
How do you say that?
I love the doctor that says, you're wasting my time. Don't bring me treatments. I don't want to know anything about it.
We will never discuss this protocol again. That's what it was. And she was asking about a mini-stim.
Oh, wow.
And the doctor said, we will never discuss this protocol again. And there is huge amounts of data showing that mini-stim can be equivalent. So why would you not discuss? Even if the patient's completely out to lunch, why would you not discuss it with her? Last night I was delivering a baby from a surrogate. The intended parent asked me about vitamin K injections. I already know the data on vitamin K injections. God, yeah, I know it inside out and backwards, right? Like we had over 2,000 comments on our vitamin K post. I still see one every once in a while.
Oh yeah, they still show up.
Oh my God, it's terrifying. And I know the data, and all the people that think that vitamin K is dangerous or harmful, they're all out to lunch. They're all wrong. Flat out, completely, argue all you want, you're wrong. Okay? Scientifically, easily proven, you're 100% absolutely wrong. But I had a pleasant conversation with her. I explained the risks. I explained the benefits. There are no risks. I told her what the benefits were. I explained what happens if the baby doesn't get it. 1 in 74 babies will have a vitamin K dependent bleed event, which can include a stroke. And she was like, no, I don't want that to happen. I'm happy to take the vitamin K. So, I had the discussion. I easily could have been flippant and said, I'm the doctor and we're not having this discussion again. But she probably would have slapped me clear across the head. And I don't get how, again, patient client.
Yeah.
Right. But like even if you're just a patient, which I totally respect, I shouldn't say just a patient, even if you're viewing it as a patient only, don't you deserve good care? Don't you deserve respect? Like, don't you deserve to know the risks and the benefits and your options? And certainly if you're a client, would you go to buy, we talked about cars, would you go buy a Porsche and not know about the Porsche? Like if they didn't tell you what the horsepower was and what the engine was and how it performs and gas mileage and whatever, how many cylinders it had, like you're not going to buy the car. You're going to say these people are crooks. They're just trying to foist this vehicle on me for whatever amount of money it is. I don't get it. How is it different in medicine? How can people go to a doctor who says, I'm the doctor, this is the way it's going to be? That's why when we go to the UK, we're going to annihilate the UK market. Because I actually listen to people and I work with you and we come up with protocols that suit you, not me. It's you that's important. So I don't get it. I really don't. It's bewildering. And her comments about the way her doctor interacted with her were so bad. I literally, the first thing out of my mouth was, on behalf of all REs, I sincerely apologize. This is horrible. Like, I'm ashamed to be an RE seeing other REs do that. That's just wrong. Crazy, right?
Absolutely insane. Absolutely insane.
Terrible.
But great story for what it was worth. I was all in on it.
Yeah, I'd go sit in front of the guy with this mug.
Yeah. That's all you'd have to say.
Yeah, just sip your tea in front of him with this mug.
Just let him know.
Great mug. Yeah.
Just let him know. Dr. T and Dr. V, after almost 2 years of TTC, 1 failed IVF cycle and 1 miscarriage, we just had a positive result today naturally.
Oh, that's awesome. Congratulations.
Is it safe to continue melatonin, also high iron pills?
Yes, absolutely it is. No harm whatsoever. And I would encourage you to continue. Don't disrupt your pregnancy. Yeah.
Hello, doctors. When doing IVF with ICSI, when you have low sperm parameters, do you use Zymote for sperm washing?
We do. We don't necessarily use Zymote. We use one product from a company called LensHook. It's supposedly even better than Zymote. But it depends on the quality of the sperm, how good it is, how bad it is. You have to remember that the microfluidic chambers, which Zymote and LensHook all have, are highly proficient or efficient at eliminating not good sperm. So if you have really weak sperm, you're going to end up with very few sperm. So sometimes we don't even get enough to use. So it is important that you screen out bad sperm, but there are different ways to do that. And we have a lot of different techniques we use at our clinic to make sure we're getting the best results possible.
How could you improve euploid embryo rates? Thoughts on PRP? I'm 39 with endo. Start 3rd mini IVF soon.
You can't. So PRP is useless for improving your euploidy rate. It absolutely will not do that. The egg genetics are predetermined. You're not going to improve that. So anyone that tells you that is absolutely lying to you. And there are studies on that as well, which show there's no difference in euploidy rates. There's actually no way to improve the euploidy rate. The only thing that might be beneficial is the right protocol. The right protocol is a mix of urinary and recombinant gonadotropins. It's from a UK study with lots and lots of cycles, where they said that was the best ratio for getting the highest number of euploid embryos. And then the other thing is duration of stim, dose of stim. You don't want to use stuff that's going to damage the eggs. So we don't do high dose. We don't do long protocols, that kind of thing. That's probably about it. It's more about what you don't do than what you do to improve your euploidy rates. You can't really improve the euploidy rates. You can just mitigate getting bad euploidy rates or high-end euploidy rates.
So Carly's asking, is there more accidents per year on the Autobahn versus a regular highway?
No, the Autobahn is actually much safer because people know how to drive there. Although you'll come flying over a hill at like 200 kilometers an hour, and there's some dude in his tractor, like literally like a farming tractor on the Autobahn for some godforsaken reason in the middle or the left lane. And he's going like 100 and you're doing 200. You need good brakes.
You need good brakes.
Yeah.
That's amazing that you don't actually have more accidents.
They don't.
They don't, eh?
No. In fact, I think they have fewer accidents. If I remember correctly, because I looked this up once, I think more of their accidents tend to be lethal because they're going fast, but they have fewer accidents.
Yeah. I just quickly Googled it. Lower accident rate per distance traveled compared to U.S. highways.
Yeah. They're better drivers. They're paying
better
attention.
drivers, higher quality roads, and more consistent driving conditions.
Yeah.
Amazing.
The road we were on with Jonathan Tettleman, it was around this lake. It was all like windy. Oh man.
Is it good to drive on a windy road? with a fast car? Like what? Like was that? That's
anyone
it.
can go fast in a straight line.
I know.
It's the swoopy that's
It was
fun.
great.
Oh, it was amazing.
You were like James Bond that day, eh?
We were James Bonding
You
together.
were James Bond that day.
It was fun. We had a really good drive. And the best part was he was trying to find food for his wife. And he wanted to go, we're in this like nice fancy sports car. And he's like, do you want me to stop at McDonald's? So it was great. He's such a nice guy. So we had a great time together. It was fun. I was hoping he'd break out into opera and I was going to record him, but he was just enjoying the drive. So
normal guy, eh?
Very normal guy in person. Very, very funny. Yeah.
Do you recommend DNA fragmentation test for male factor due to varicocele? We are a young couple, but so far have had 2 failed FETs of 4 untested embryos and only 2 embryos left in the lab.
If you want answers as to the potential source of damage for your embryos or failure for your embryos, that's likely going to be the lowest yield of all the different tests you can do. So I would be looking at the things I mentioned earlier in the show: shape of your uterus, volume of your uterus, your hormones, your thyroid, your vitamin levels, your weight, your social habits, smoking, drinking, drug use, marijuana use, your partners as well. I'd look at genetics. I would look at your immune system and your microbiome, thrombophilia screen. Like there's a whole litany of tests we can do for you. The problem with sperm DNA fragmentation is it is associated with poor outcomes, but there are things like blastulation, so how many blastocysts you get, and then miscarriage. So you've already got your blastocysts and you're not getting a miscarriage, you're getting failures. So I don't think that's going to help you. That doesn't compute.
Do you price match quotes from other doctors?
No. I mean, I'd be curious to see what another doctor is saying. Generally speaking, we're way cheaper than almost anybody else across Canada. Like way cheaper. And we're way cheaper than almost any US program except for one that I'm aware of. And we call their patients refugees. So I don't recommend that people go there. But I'm happy to listen to anybody. We don't do special pricing, but I'm certainly happy to see what somebody else is offering. And if we need to compete somehow, we would.
Do you eat McDonald's? Carly's asking.
I do. I had McDonald's on my drive back from the cottage.
Yeah, it's a cottage thing for you, right?
It's a cottage
thing.
Well, I asked Wendy and Matt were in the car with me, and I said, where do you guys want to go? And Matt said McDonald's, so we went to McDonald's. But I only eat filet of fish.
That's crazy too, to be honest. I think we've talked about this before. That's the wildest thing I've ever heard. My son the other day, he's like, he had a birthday party with his friends or whatever. So he goes to the birthday party, and then after the birthday party, apparently all the kids were really hungry. So the mom took a couple of the boys to McDonald's to eat another dinner, I assume, right? Anyway, my son comes back home. He's like, Papa, the Big Mac, that's like the biggest sandwich McDonald's has. Like, that's like the king sandwich. Like, that's the ultimate McDonald's sandwich, right? I'm like, okay, yeah. Okay, and he's like, well, I had the double Big Mac, and it's way better. So McDonald's is the talk of the house.
I can handle a fillet of fish.
Yeah, I think it's even healthy, maybe.
It's fish.
It's fish. You got some omega-3 in there.
It's fish.
It's flaky.
Yeah.
It's real fish.
Yeah, it's definitely fish.
Yeah, it's real fish.
I don't know where it's grown or where it's swam.
No, I think it's they catch it. I'm under the impression the fish is a good quality piece of.
I would assume that McDonald's is probably
growing them,
growing the fish.
Yeah,
like they probably got fish farms somewhere where
they must have a fish.
That's a fish, right? Like, but I think that's their probably least sold sandwich is the fillet of fish.
I've never ordered it in my life. I'll be honest with you.
You've never had a fillet of fish?
There has never been a moment in my life where I went to McDonald's and said, you know what? Forget about the beef. Forget about the chicken. give me the fish.
Really?
Never in my
It's
life.
actually good.
It's actually good.
Yeah.
You know, maybe I'll actually try it.
Next time
Maybe I'll try it
when we have cottage weekend together,
we'll go get it.
We'll go get it on the way.
I got pregnant through IVF and had a miscarriage at 7 weeks pregnant 1 month ago.
I'm so sorry.
Is it too soon to try again?
No. There's no benefit in waiting. That's been proven scientifically. What time is it?
46.
Okay.
What's up, docs?
Bedeep.
Why no swimming after FET? When can you start swimming again? Thank you.
Who said you can't swim after FET?
That's what that guy said.
This week, someone released a study apparently saying that you can actually exercise harder in pregnancy than they thought you could. I'm not convinced yet because it's only one study, but there's no evidence I'm aware of that says you can't swim after FET. If anybody is aware of a specific study, please put it forward because I've never heard of that before.
What about all that chlorine gets in there and causes
It's not like you're swimming with your mouth open.
No, yeah, you're right. But it doesn't affect anything, all the chlorine?
You'd have to swallow a ton of pool water.
Diffusion into the skin, no way?
No.
None of that?
No.
Not coming in.
No, and
That's weird.
And for women, the vagina coapts together.
Right.
So it's relatively waterproof. Relatively.
I wonder what the reason is then.
I've never heard of that before.
You never heard of that before?
I mean, would I go diving? No. Would I jump into a freezing cold pool? No. But can you lounge around in a lukewarm pool? Sure.
What about a lake? Would you go to a lake? Bacteria, stuff like that? Danger?
Lakes have a lot of bacteria.
Lakes have a lot of bacteria. Absolutely.
That might be a different story.
There we go. I gotcha.
Yeah. My nephew split his elbow open wake surfing.
Yeah.
Like open. We had to get him stitches.
Oh, wow.
And I was looking it up because I don't deal with lake lacerations.
Yeah, sure.
And they were like, yeah, you need antibiotics when you.
Oh, no way.
When you get cut in the lake.
Antibiotics.
Yeah. Having said that, we have zebra mussels in the lake, and I've sliced my foot open on them multiple times, like dozens of times. Now I don't go in there without shoes, and like water shoes, and I've never taken antibiotics. And my foot's like hemorrhaging blood.
Sometimes people are a little bit, overly paranoid. There's a little bit of, little bacteria. Never,
I don't dry off when I come out of the lake.
You don't dry off when you come out of the lake.
I let the water just dry off naturally.
Okay, it's hot.
Yeah.
Yeah, sure.
Everybody else is like towel.
Oh, towel. Oh, really? You're just chilling.
Let it dry off.
You're the man. You're the man. That's what that is. That's a real man over here.
Well, I'm not doing it in May, but summer months, like this whole last week,
this whole week.
I never used the towel.
It's almost impossible to be outside. Is Unisom B6 for nausea safe during pregnancy?
I have no idea what's in Unisom B6. We don't have that product here.
For someone with highly suspected endometriosis, how would you proceed? I was given estrogen priming for all my cycles and was told it was fine. I had no other change in protocol. Seems wrong.
So, read that again.
You heard it. You heard it. That's right. For someone with highly suspected endometriosis. So it's still not concluded. It's just a hunch. How would you proceed? I was given estrogen priming. That's right. Estrogen priming for all of my cycles and was told it was fine. I had no other change in protocol. It seems wrong.
Well, look, there's no evidence, but estrogen priming for endometriosis just makes no sense. You are intentionally inflaming the endometrium at a time when it's most critical to not have it inflamed. So does that make sense? Absolutely not. It makes no sense whatsoever. Yeah. What other changes would I make? Lots of natural supplements, lower dose stim, priming often with testosterone, human growth hormone, DHEA, but I would never do it with estrogen. Never. We very rarely use estrogen priming. 2 randomized controlled trials showed no benefit. One showed a possible detriment. And it doesn't make sense for an endo patient. So why would you?
Unisym is doxylamine.
Doxylamine?
Yeah, doxylamine.
Oh, yeah, that's diclectin. We use that all the time.
There you go. I did spin class my whole pregnancy.
I did what?
Spin class.
Oh, wow. I'm not going to say anything. There are women that believe that exercise in pregnancy is fine. If you look at the current body of research, it suggests that whatever you were doing before, you can continue doing. So I would say that that's fine. But you're not supposed to go more intense when you're pregnant. This new research says it doesn't really matter what you do when you're pregnant. I don't know. I probably am going to tell my fertility patients who have worked very hard to get to where they are, obviously, that they should be judicious in what they choose to do when they finally become pregnant. Why risk it? Like, it's not the right time to need to stay super fit. Just stay fit.
I visited your clinic in 21, 22 for IUI.
Okay.
It wasn't successful, and now I'm 40 years old.
Okay.
If I wanted to try IUI again,
yeah,
do I just call the clinic?
If it was 3 years ago, 4 years ago, you would need a new referral if you're local. But yeah, you just come back to us and we'll help you out again.
I have an appointment with you in November. How long is the process for answers?
Well, it depends on what's wrong. So if you need garden variety testing, it takes a month to 6 weeks to get all your test results. And then by November, we'll have additional people here who will cut down the wait time to be seen and have their answers given to them, hopefully to within 30 days. That's the goal. So we're working on that, and it should be in place by November. So it shouldn't be very long. I would say a month to get your tests, a month to get your answers.
Five miscarriages.
Oh,
found out I have endo and adeno.
Okay.
Using donor eggs. Odds of success.
You're doing the wrong thing. So respectfully. So donor eggs does not solve recurrent miscarriages. I need to know why you're miscarrying. Is it the egg quality? Is it your social habits? Is it your body mass index? Is it your partner? Is it genetics? Is it immune? Is it microbiome? Is it vitamins? Is it thyroid? What is it? Because until you know what's actually causing miscarriages, you could spend a small fortune on your IVF cycles with a donor egg and miscarry your donor egg embryos. So don't jump into donor egg as a solution to miscarriages. I just posted on this the other day on Instagram where I said IVF is not a solution for recurrent pregnancy loss. It isn't. And donor egg is definitely not a solution for recurrent pregnancy loss. It's an insanely expensive potential waste. We have hundreds of patients where we are now able to figure out what's wrong with them, immunological, microbiome, and we get them pregnant. And many of them don't even need to do IVF. So before you start investing into donor, reach out. Let's figure out what's wrong with you.
Serious?
Yeah, that makes no sense. I would love to know who said to do that.
Serious question.
5 losses and
crazy
and no answers.
No answers. Yeah. When I read it, I'm like, my God.
Horrible.
My OB said I had my second trimester loss from ureaplasma. He never really explained what that is.
Ureaplasma is a bacteria that's very good at protecting itself from antibiotics. And in animal studies, veterinary studies, has been proven to be associated with adverse outcomes, especially miscarriage and pregnancy loss. In human studies, they've never actually shown it, but we all know that it causes it. So we all treat ureaplasma. We now are doing PCR-based testing to see if it's there or not. And when we see it, we do our very best to eradicate. It is notoriously resistant and difficult to get rid of.
Really? Even with the antibiotics?
Bad. Pain in the ass.
But it goes away eventually with antibiotics? Or like you got to like do more? Really?
It's difficult to get rid of.
Wow.
Yeah. Very difficult to get rid of.
Huh. Science. You guys got a long way to go.
Yeah.
I have 3 euploids, 2 LLM and 2 HLM.
2 low-level mosaics and 2 high-level mosaics.
Right, low-level mosaics. Gotcha. We'll be doing 3 months suppression with you due to mild adeno.
Sure.
What are my chances at success of having 1 child?
So you basically have 5 that have the same chance, the 3 euploids and the 2 low levels, and then 2 more that have about a 35% chance, depending on whether they're segmental or whole chromosome. So what's your overall chance? Very close to 100%. I would say 99% you'd have at least 1 child. 5 euploid embryos results in a 98% chance, 98.1% chance of having 1 live birth. Throw in 2 more high-level mosaics, you're probably getting very close to having a 99% chance.
There you go. Good news. I'm on.
And that's in a program with crappy results. Well, not crappy, but not great results. In a program with great results, it's probably even better. So yeah, I would say very close to 100% chance.
Would you recommend PRP with somebody with DOR?
Listen, the PRP debate still goes on. There are people that believe in it, entire clinics dedicated to it, where they claim that ovarian rejuvenation is a thing. And yet the data actually supports that it is not beneficial based on available studies to date. So there are critiques of those studies. I don't necessarily feel that those critiques are valid. Do I offer PRP? Yes. Do I think that PRP is the way to go for everybody? Not necessarily. I think that it can help in certain circumstances. I feel if it is going to work, it's going to work in young women with diminished ovarian reserve. But I got calls once people knew we were doing PRP from 50-year-olds and 47-year-olds and 52-year-olds, all hoping PRP was going to be their savior. That's not going to do anything for those people. You still need a ton of eggs, and the PRP is not going to give you that.
8:59.
One more question, because I am post-call and delivered 12 babies, and I'm exhausted. 11 babies.
All right, let me try and find.
No, 12 babies.
Should I try and find a doozy? Should I get you?
Yeah, sure.
Oh,
trip me up when I'm down. Thanks, pal.
Hello, Dr. V and dear Tariq.
Oh,
I'm going for this one. All based on intro. How many IE should be used for a low dose stim for FET? Doc says 37.5 per Govaris is enough. Thin lining problems occur again.
I would never use Pergoveris. That makes no sense. It should be Gonal-F, a recombinant FSH product. And the study, there's a Chinese study, I want to say about a year ago, and they suggested that you use 1 vial, so 75 units every day. So that's what we do when we're doing it. Do we miss it on TikTok?
No, still good. Oh, I just want to
check.
Okay,
we're going to sign off. Thank you, everybody, for watching Fertility Fact or Fiction. I am your exhausted host, Dr. Rahi Victory, with my dear friend who's going to show himself.
Hello.
Doctor, in quotation marks, Tariq Ibrahim.
That's right.
From Ibrahim Strategies Group. He is a doctor of all things social media only. And we are going to be back with you again next week, hopefully back at our normal time.
Tuesday would be great.
Tuesday or possibly Monday. Because we had a good turnout.
We had a good turnout on a Monday.
So why don't you throw up a survey? Put up a post or something and ask people to tell us.
Monday
put up a poll Monday or Tuesday. Tell us what you think. If you want us to move the show, we will move it. And lots of exciting content coming out and lots of really exciting stuff happening. Also, if you're in Canada or local in the States, New York, Michigan, that kind of thing, Indiana, there will be a Canadian fertility show happening in October in Toronto. It's going to be at the Harbor Castle Westin. Please join us for that show. I am going to be a headline speaker there. There's going to be a lot of great people there. Prati Sharma is going to be there, and lots of other amazing speakers. And lots of great programs. Fertilicists will be there. Some clinics will be there. Lots of vitamins, nutritions, naturopaths, all that kind of stuff. So please come out, check us out there, and join us at our booth. We are super supportive of that endeavor because it's a great cause, and we're really hoping to make the show bigger and better than ever just by attending and supporting it. So, Canadian Fertility Show, it's in October at the Harbor Castle Westin. Look it up on Instagram, Canadian Fertility Show. Have a great night, everybody.